GPs in England, this is this new idea to try to cut hospital waiting lists. We had to claim £20 every time they do not refer a patient directly to hospital. My word, that's got open to abuse, is it not?
There has to be some kind of checks and balances here, doesn't there? It's part of the government plans to reduce NHS waiting lists, with ministers claiming that it could speed up treatment times, probably by helping you die. So if you think it's hard to get a referral to hospital now, it's only going to get harder. Let's
get more with former NHS chairman and health commentator Roy Lilly. Roy, when I read this story, morning to you, I thought, well, good luck getting to see the GP in the first place, because that is one of the ongoing problems. To see a GP face-to-face, maybe you can talk to them on the phone, maybe you can have a Zoom meeting. But this is a whiff about this that I don't really like, Roy. I get they don't want people to go to hospital unnecessarily, but why are doctors sending people to a hospital unnecessarily? Why do they need to be bribed £20 not to do so?
Andrew, good morning. OK, look, I mean, you know I'm an old lag when it comes to the NHS, and I remember a time when GPs used to phone up their mate, who's the consultant in hospital, and says, I've got Roy Lilly here, he's got a spot or a whatever it is, and what do you think? And the consultant say, well, try this or that and the other, and if that doesn't work, then refer him to me. And that was that's the genesis of all that. That was collegiate working, and it worked well. Then, of course, over the years, we've seen all of that erode, and we've now got contracts between primary care and secondary care and all the rest of it. And there has been a trial. I mean, what goes around comes around. If you live long enough, you see everything twice. So we're now seeing this happening. There's been a trial in various parts of the country where GPs have been paid not to just refer somebody to a consultant, which is more waiting and it's more congestion in hospital, but to ring the consultant up and say, I've got this patient, these are the symptoms, I think this, what do you think? And there's a kind of a conversation about the patient, and they'll try and sort it out on the phone. It makes a lot of sense. Now, the GPs, of course, are being paid 20 quid to do it, because you can't get GPs to do anything outside their contract without paying them. So it's going to cost 20 quid. Now, no one's paying the hospital to answer the phone. Now, there is an impact of this, because hospitals get paid with outpatient appointments. Right. And so every time someone goes to a hospital, ka-ching, they get paid. Now, it's more expensive than the 20 quid, much more expensive. But it is important, and I explain why. There's a lot of cross-subsidy goes on in a hospital. So if you take, for example, a cataract operation, where there are more cataract operations now being done outside the NHS than there are inside the NHS. It's being done under contract. Now, it's a fairly easy operation to do, very low complications, and it's like an in and out job, really. But the hospitals use the money to cross-subsidise the more complicated things they do, like retinopathy, age-related macular degeneration, all the stuff that they don't make money on. So I'm sorry it's such a complicated answer, but it's a complicated topic, because this financing thing is very carefully balanced. And you said it yourself, Andrew, you did the sort of maths, back of the fag packet maths, saying ka-ching, it's going to add up to a lot of money. Yeah. But it's actually a lot of phone calls. So what happens? How does the consultant in hospital do that? It's not just the odd phone call from a GP. This is now going to be standard practice in 6,000 GP practices up and down the country. What does the consultant stop doing so that they can have a session answering the phone? It's a complicated thing. It's a good idea, but it's complicated.
Roy, just finally and quickly, most GPs are private businesses, aren't they? What's to stop an unscrupulous GP and business from taking advantage of this and putting people's health at risk?
I don't think they'll do that. I really don't. I mean, are there unscrupulous GPs? Well, there have been in the past, and there's been Shipman and all the rest of it. There have been some pretty bad people. Fundamentally, I think we've got to work on the basis that GPs are decent people and they're trying to do the right thing. I think there's sort of more of a check in this bit when they would ring up the consultant, and the consultant would ask the sort of questions through the GP of the patient and figure out what the best care plan is. So I'm not concerned so much about the risk in the system, but I am concerned about how the finances are going to work, because as Andrew just, he just did his maths, multiply the number you got to by 6,000 and then multiply it by 5 days a week, 52 weeks a year. It's a lot of money, but it's a lot of phone calls, and that's the problem.
All right, Roy, that's Roy Lilly, former NHS chairman and health commissioner. Thanks so much for joining us and explaining it.
Have you been getting a load of spam in your email recently? What about random calls? It's really annoying, isn't it? Data brokers are out there collecting your personal information. Anything from your email, your full name, your address, and even your political affiliation. Cyber criminals can even use AI to mimic the voices of friends and family to trick people into sending them money. And it gets even worse. People out there are getting huge loans taken out in their names without even knowing about it. But don't worry, because the sponsor of this video, Incogni, can help. They reach out to the data brokers on your behalf and request that your information is removed from their databases. Incogni continues to make sure that your data is removed automatically from the internet via repeated removal requests. So, how can you get started? Well, step 1, hit the link in the description, create an Incogni account and tell us whose data you'd like removed. Step 2, grant Incogni the right to work on your behalf. Step 3, sit back, relax and watch Incogni work. They will update consistently so you know when your data has been removed. Incogni is risk-free for 30 days, so you can try it for yourself and you'll get a free refund if the service isn't for you. So take back your personal data today with Incogni. Use the code GBNews using the link in the description below and you'll get 60% off an annual payment plan.
Can I ask you then about that scheme that you're here to talk about today? It's been picked up by many of the papers this morning. Family doctors get a £20 bonus if they keep patients off waiting lists. I mean, that's going to make people very nervous. They already find it very difficult to get a doctor's appointment. Then they find it very difficult to be taken seriously and to get the referrals that they need. Are you massaging the figures here at the detriment and to the detriment of patient care?
Our commitment to make sure that people are not waiting longer than 18 weeks by the end of this department is absolutely our focus in the health service, getting those waiting lists down. Over 6 million people, over 7 million cases waiting on those waiting lists. The Conservatives kept putting more and more money into, you can describe it perhaps as a leaky bucket. They didn't fix the foundations. We are looking at waiting lists differently. We're using all levers available to us to make sure that people get the right care as quickly as possible in the right place. This project called Advice and Guidance does happen in different parts of the health system. It hasn't been rolled out wide enough. We want to take the best of the NHS to the rest of the NHS, and what this does do is make sure that people are treated more locally, that their GP has a better relationship with specialist hospital doctors to get that advice from the specialists to make sure that patients can be treated more quickly. And I think that's something patients really, really welcome. So we will think about tackling these waiting lists differently to the Conservatives. We want to make sure that taxpayers' money is used in the best way possible to get people off these waiting lists. That's both making sure they have more diagnostics, for example, but also that patients don't go onto the waiting list unnecessarily if that's not the case.
Minister, please, look, before we run out of time, I mean, the problem with this is if it's about treating patients on merit, if it's about providing the right treatment, why are you having to incentivise GPs up to a cost of £80 million?
We recognise that there is an extra administrative requirement placed on GPs and practices to make this work, and that's what the payment is for, to get patients better treatment, more efficient treatment, more effective treatment in the community, close to home, supporting general practice. We want to have more care taken out of hospital into the community. That's what patients want, that's what we promised in our manifesto, and that's what we are determined to deliver.
OK, Minister, we've got to leave it there. Thank you for your time this morning.
Thank you.
gbnews.com/your say on that. It's very, very difficult to get an answer, I think.
Get a straight answer there. Yeah, let us know what you think on that one.
What are we to make of this move by the government to reduce hospital waiting lists by apparently spending £80 million giving GPs bonuses so that when they don't refer people to secondary care. Now, is this something which is a sensible way of looking at this, getting those numbers down, making sure people are sent in the right direction rather than just very easily put on a list and sent to hospital?
I'm afraid, look, I don't know any GP who refers people to services that they don't need and don't require, right? On the flip side, of course, I don't want to see, I want some sensible moves in that direction as well if there are possible ones. I think this is a smokescreen, though, if I'm totally honest. We all know that GPs who've come to my surgery in the last few weeks and months have all said they are not being compensated for the national insurance tax rise, which is absolutely hammering GP services up and down the country, and it's costing them hundreds of millions of pounds. So this money here is just an absolute drop in the ocean as to what the government is already forcing them to pay out. And you know what that means? It means that the moment that GPs are going to have to restrict services or cut back on staff like receptionists and other things who are absolutely those frontline actual NHS workers, ensuring people can get appointments, they're going to have to cut back on that because of the national insurance tax that Labour has imposed. That national insurance tax is hitting businesses which actually create the wealth in our country to fund our public services, and it's also hitting the public services like our GPs, like our schools, and both have got in touch with me to say all the money that's been provided by the government to notionally compensate them for the rise in national insurance isn't enough, and they're going to have to cut back on staff as a result of it. I just think it feels to me like a gimmick when the GPs are really crying out for proper support.